This is a module I created, sort of a review module out of Rehab Works that I call the Educated Consumer Checklist. And I framed this from the perspective of sort of like a frequently asked questions format. In this case, it'd be more like frequently experienced scenarios. These are things, situations that you might experience as your loved one goes through treatment, that the bottom line is you want to know how to be able to respond when you hear some of the statements that you see on this list, because it's in not knowing how to respond to these things is where they fall through the cracks. Picture those statements on those line items there. I'm not as bad as everybody else here. If you're not sure how to respond to that, just picture that line going down, falling into a crack. And as I said, in this business, small cracks can become big cracks real quick. And I know that from experience. And some of you listening to this have your own experience. You've been through rehab before. Some of these are going to sound familiar. I know that when I read most of these off, lots of people nod. Yep, we've heard that one. Yep, we've heard that one. So let's just go down this list, and I will give you a few pointers on the direction that these items point to as far as what you can be learning about this and know how to respond to this. So this first one here, where it says I'm not as bad as everybody else here, that's usually prefaced by get me out of here, I'm not as bad as everybody else here. If you understand what it means to be diagnosed with a substance use disorder, I actually should back up. I would have said, we could create a couple of buckets, main areas for you to focus on becoming an educated consumer. And the first thing is, as I said in that video last week, I want you to learn everything you can about addiction and how it's treated. And so right there, even I just used that term addiction. That's a sort of misnomer. That learning about what a substance use disorder is, you'll understand where that term addiction fits in. That's sort of a lightning rod, and we can get into power struggles and argue about the term addiction. And again, understanding the medical condition and the diagnosis for having a substance use disorder is the first thing you want to become, and like I say, a student of, because it's in understanding this that a lot of offshoots are going to come from for you to be able to respond to some of these statements. And so if they say I'm not as bad as everybody else here, you know that that's probably they're referring to their drug of choice was not as quote unquote a hard drug like some of the other people here. But your response could be, if they've been admitted as a patient in a substance use treatment program, they have to have gotten a diagnosis of having a substance use disorder. And as an educated consumer, you will know that if you are diagnosed with this, it needs to be treated, and there's a specific way of treating it. And you're going to understand things like learning to manage the condition, or, deciphering what this term recovery. As I say, I'm a fan of using the term managing the condition, but all you have to say when they say I'm not as bad as everybody else here, you can just say you need to be in recovery from your substance use disorder. Doesn't make any difference how bad you were, you need to be in recovery. Or here's another common one. I'll quit the hard stuff, but I can still smoke pot. Again, as it says there on the right-hand side, cross-addiction, understanding the difference between abstinence versus switching chemicals or cutting down. That falls under the category of learning about substance use disorder. When you are a student of understanding substance use disorder, you're going to understand the phenomenon of cross-addiction, and that's all you have to say in responding to your loved one. I'll quit the hard stuff, but I can still smoke pot. Please define cross-addiction to me, because, again, a lot of my stuff here is based on the premise that the clients are learning this in treatment. They just might not want to share some of these details with you. They're probably learning about the phenomenon of cross addiction, and the potential of switching to another chemical either opens the door to a new addiction or brings them back to their drug of choice. Here's another very, very common one. I need to focus on my depression. Okay, lots of treatment clients have a dual diagnosis. They have a substance use disorder diagnosis and they have a mental health diagnosis as well. And lots of times, this is sort of a true fact, that they tend to want to avoid addressing the substance use side of the equation, and they'll say, I want to focus on my depression. But when you understand substance use disorder, you'll also understand that to effectively treat a mental health condition, you need a level playing field. And substance use creates a really uneven playing field. You have to get the substance use out of the way. And so and you will also, learn as you dive into this that yes, you treat them as co-occurring conditions concurrently is what I was going to say. But the really important thing is to not lose sight of the fact of the importance of treating and being in recovery from the substance use disorder to be able to make effective progress on dealing with the mental health side of the equation. Then we got some things like I can be around my friends and not smoke. Again, understanding what substance use disorder means. You understand, the vulnerability to triggers and their ability to control or lack of being able to control their behaviors when it comes to substance using. I don't need to go to IOP. There's a common one when a patient starts out, particularly in a residential treatment setting, it's really common to step down to a next level of care upon discharge from that primary phase of treatment. And so IOP stands for Intensive Outpatient Treatment, and it's a very common recommendation for clients to continue in treatment in the intensive outpatient setting after they've completed residential. Some clients aren't real keen on going to IOP, and you might start hearing from them, I don't need to do that. And they might say, well, my counselor said I could do IOP, but he didn't have to. And again, that gap, that might not be exactly how the counselor is stating that, but for you, learning how a treatment plan works and what it entails, that's one piece, is knowing that treatment process is usually a step down, a series of step downs in level of care. A really important one is to recognize that discharge from the primary phase of treatment does not mean that treatment's over. And so if you hear a client saying, I don't need to go IOP, one, your response can simply be, what's the treatment team's recommendation? Because really, as an effective family supporter, that's your go-to statement. What's the treatment team's recommendation? We will support following the treatment team's recommendation. Maybe they're not recommending IOP, but it's a very common one. I'm fine now. I don't need any more treatment. Again, that's another common thing. A couple weeks into treatment, okay, they've admitted my substance use is a problem. Okay, I get it. I need to quit, but I'm doing fine now. I don't need to stay in here for all this. Again, if you are an educated consumer and understand exactly what the continuum of care typically looks like, you're going to recognize where they are in that process. I happen to go into that in a lot of detail in Rehab Works. I use what's called the stages of change as a way for, one, measuring where they are in their treatment process, and two, using it as a tool to avoid all of these potential cracks in the foundation. Then this last one, it says, or the last two, it's referring to it says AA's not for me. And AA refers to a bigger bucket there of what we call peer-based support. And that's a common one. I don't like that 12-step. AA's not for me. And one of the things that I like to focus on is the fact that AA is not the be-all, end-all, but it's important to recognize why that's being recommended or what actually it is that's being recommended. AA is one form, as I said, of what we call peer-based support. And that's, as an educated consumer, I want you to recognize the difference between peer-based support and professional care. Two entirely different aspects of, commonly represented in a treatment plan. Two different things that you get a lot from professional care that you can't get from peer-based support, but there's also a lot that you get from peer-based support that you can't get from professional care. Both can be critical aspects of a treatment plan, but sometimes they will pick one or the other, or again, they say, I don't do the AA, so they don't do anything at all on the peer-based support side. One of the things I teach families is, what do we say when they say AA is not for me? I don't like that 12-step stuff. And you can say, that's fine. Tell us what you're going to do for the peer-based support part of your plan. There's a heck of a lot of other alternatives to AA and 12-step recovery that satisfy the elements of peer-based support. And so that's a pretty good list of things that you might hear, but it's by no means an exhaustive list. But that gives you an idea of, if you being able to know how to make those responses to those type of things, that's the kind of stuff that will shore up. Yes, it sort of falls in the category of accountability. And, sorry, treatment clients, you might not really like it if the family is able to hold you accountable, but I'm just saying that one of the biggest reasons for treatment failure is that lack of accountability. The client is on their own as far as honor system. Are they following a treatment plan? And if they're really genuinely motivated and want to do everything and taking it as sincerely as possible, they're going to, follow the plan as thoroughly as they can. But the fact is, not everybody's that motivated and completely there. That's why we have treatment. And again, it's also why that treatment process lasts a lot longer than most people realize. But again, you, as being an educated consumer, are going to be in the position of knowing how to respond to all of these type of things and shore up a whole lot of potential places where that information can fall through the cracks. Last thing I'll say is there's no guarantee, and obviously this is a complex issue we're dealing with. Treatment is hard. Getting over an addiction is one of the hardest things a person might ever face in their life. But this, if we think of a pie chart, this piece of family support represents a really big piece of that pie chart in terms of the impact this can have on treatment. So I will recap here. We talked about the fact that the biggest problem with treatment is the fact that families aren't there in treatment along with the client. And until we start checking families in, there will always be inherent gaps between the client, the family, and the treatment team. But you can bridge those gaps by becoming what I call an educated consumer, learning everything you possibly can about addiction and how it's treated. And so I gave you some ideas on areas to be focusing on. One, learning about what it means to be diagnosed with a substance use disorder, learning about the continuum of care for treatment and what that typically looks like, learning about this peer-based support stuff, AA, alternatives to AA, so that you're able to know how to respond to whether or not they're following that. And then the last thing that I'll say, I didn't mention anything about this. I can hear some of you saying that, but how do we know what is the right place for us to, be controlling them? Can we have expectations about what they're doing? And that all falls into the category of boundaries, right? That's another thing that I teach in Rehab Works. It's a huge piece of this is learning how to set boundaries and what appropriate boundaries are given your certain circumstances. There's different boundaries between if the client is your 16-year-old child or if the client is your 44-year-old child, or if the client is your 44-year-old spouse, or any other combination thereof. Obviously, boundaries are going to change. But the more that you learn about all this educated consumer stuff, that's going to inform your boundaries. And lots of times it's very valuable to get some help in exploring and sort of unpacking exactly where is the right boundary or expectation for this. I do that in, I do family addiction coaching. I work individually with families to help sort of unpack all this Rehab Works and help you sort of guide you through supporting your loved one on the other end. So if that's something that you might be interested in, I'd be happy to have a conversation with you to, see if there's any way that I might be able to help. With that, I will put links below. I will wrap this up. I will thank you so much for taking this time. I really do appreciate it. If you got anything out of it, please like the video or subscribe to my channel. I have a ton of content, both for individuals, supporting individuals' recovery, as well as this family program playlist. So subscribe to the channel. You'll know when the next video comes out, and I'll see you then. Thanks.